It's lovely to be here at the faculty this afternoon with my wonderful colleague, Professor Martin McKee. Martin and I, as many people will know, have been working on some exciting Brexit work with the faculty, but there's much more to Martin, and I wanted to use this opportunity in our interview with Martin for the Faculty of Public Health for Martin to introduce himself and tell you a little bit more about the excellent work he does to help public health right across the globe.
Thank you for that introduction, Maggie. As you said, I do a lot of work in Europe. I am a Professor of European Public Health at the London School of Hygiene Tropical Medicine. I'm Research Director of the European Observatory on Health Systems and Policies and past President of the European Public Health Association. I'm also recently been reappointed to the European Commission's Expert Panel on Investing in Health. But although people may know me for that work, as you indicated, I do a lot of work elsewhere. So I lead the health systems element on the prospective urban-rural epidemiology study, a large study following up about 300,000 people in 25 countries from Canada to Zimbabwe, including India, Pakistan, Bangladesh, Colombia, Brazil, and Peru, and many others. And I also do quite a lot of work in North America. I'm a former chair of the board of the Global Health Advisory Committee for the Open Society Foundation, the Soros Foundation, and I'm also heavily involved with colleagues at a number of American universities looking at the health crisis that they're going through.
Well, thank you, Martin, and thank you so much for joining us this afternoon. I'm really pleased to be able to have a chance to speak to you about the future, our future in Europe, particularly now that we know that things are more probably certain on the Brexit journey. And the reason I particularly like to work with you, Martin, is I do really like the evidence-based way you work, and while you're very bold in your statements and make sure that people do get the right evidence and messages, I have to say that I find you remarkably non-party political, and I think that's important in the way the faculty works. So my first question this afternoon is really if you could identify for us some of the things that you think are the greatest concern if we exit the UK without a deal.
Well, we can start off by looking at what the European Union does, and it guarantees free movement of goods, services, people and capital, and that has immediate implications for our relationship with the rest of the world. In particular, every independent forecast shows that there will be a severe hit on the economy, so there will be less money to go around. The Office of Budget Responsibilities forecast published after the election show about an £18 billion hole in the government's finances. We're particularly concerned about free movement of people. That has many implications for public health. Obviously, for the health service, there's been a catastrophic drop in the number of nurses coming to the United Kingdom. A large number of doctors are from other EU countries, but in particular, we're concerned about social care. When it comes to the free movement of goods, our greatest concern there is with food. Food that we import, we're heavily dependent on fresh vegetables from other parts of Europe in particular, but also in fresh fruit and vegetables from other parts of the world that we import within the framework of trade deals negotiated between the European Union and other countries. People often forget that the European Food Standards Agency has inspectors on the ground in 130 countries to make sure that the supply lines are safe. We have the other problem, which is going back to the issue of people, which is that already crops are rotting in the ground. But leaving those aside, I think there are two other concerns that we need to be worried about. One is that this is already absorbing all of the capacity of the government. We have seen movement, transfers of many civil servants to work on Brexit-related activities, often going around in circles because we have no clear indication of where the end point will be. And although it fortunately has not been the case so far, although we should remember, of course, Joe Cox, there is the concern about civil disorder when you have a government that has been stirring up division within society, and when you look at some of the messages that have come out from prominent politicians, including the Prime Minister.
Well, thank you, Martin. And sort of focusing on the faculty's role, it strikes me in my role as President that we probably need to try and work harder to get the right collaborations with our colleagues in Europe?
We're very fortunate. The European Public Health Association has made it clear that they will support the United Kingdom, our colleagues in public health in the United Kingdom, and that is a priority. Obviously, the connections are going to be more difficult. We have no idea where the end point will be. It's not entirely clear that the Prime Minister knows where the end point will be, and that will have implications for collaboration in research. Major issues for collaboration on data, because it will, of course, be illegal to transfer data outside or between the EU and third countries, and that is an issue that is not resolved, with major implications for security. We've written previously about the exchange of information on drugs and organised crime, but also for infectious disease surveillance. That will be a problem. So there is a very clear view in the rest of Europe that they will do everything possible to support colleagues in the United Kingdom. The difficulty has been that the British government, unfortunately, has been extremely unhelpful with much of its messaging. It has delivered its intentions late. It has agreed things in Brussels and Luxembourg and Strasbourg, and then repudiated them as soon as it has returned. I think people are puzzled as to where the government seeks to be, and within that you have the makings of a real challenge.
Yes, so there's an even greater need to actually ensure that we have this alignment and helpful relationship with our colleagues in Europe.
There is, and also I might just add that the faculty clearly has a very strong role to play here, as have the entire public health community, in holding the government to account for its promises. It has said that it will ensure that there will be, for example, no paperwork or free movement between Northern Ireland and Great Britain. Well, that is clearly not going to be the case if they move away from the level playing field. There are all sorts of other things that they have provided assurance that will be all right, but yet they can never provide any detail. And that contrasts remarkably with what the European Commission has put out. They have issued very detailed notices to operators and to stakeholders, setting out the legal basis of what might be the situation. In general, what they've done is they've said, let's consider the United Kingdom as a third country like South Africa. They've used that as the template. But we have no idea where we will be, because we still seem to be putting out a message that nothing will change, when in fact everything will change. So we need to hold the government to account. We need to document the health impact of what is going on. We need to document in particular the problems of food prices, food shortages that we're already seeing.
Martin, thank you for those excellent comments. In terms of the transition period, I think that's quite a complicated area for people to really understand. Do you think you could help explain that to us?
Well, I wish I could, because the first problem is that it's not a transition period. The idea was that there would be a transition period in which the government would implement what it had already agreed for the future trade agreement. It clearly has not yet reached agreement on the future trade agreement, so we don't know where we're transitioning to. It is an extremely ambitious programme to get a trade agreement within a year. It would be possible if the government was committed to having full and dynamic alignment with the European Union, in which it retained all of the EU laws, but also if it then agreed to update them. But already, only a few days after the election, the Prime Minister has said that he will allow the lower courts to rescind settled European law. So clearly that's not going to be possible. This is yet another example of where those of us who have been trying to understand the intentions of the government find it impossible to know how they will square the circle. That said, in theory, nothing should change during the transition period. The problem comes at the end of it, because then you have to move to the new situation. Now, the Prime Minister has said there will be no implementation period. You will go immediately from from the 31st of December to the 1st of January to the new status quo. That is clearly impossible. That will require the building of substantial infrastructure at borders, including not just Dover, but also borders on the British mainland for the Irish border. So it will also require new information systems, and it will require the creation and significant enhancement of existing institutions like the Medicines and Healthcare Regulatory Authority, which will have to then take on a lot of roles that are done by the European Medicines Agency, at the same time as losing much of its budget, which comes from the European Union, and also the loss of specialised staff. So you've got a major programme of strengthening or creating entirely new, in some cases, institutions, of putting in place entirely new information systems and training staff, training customs officers and so on. And given that we may not know the nature of the future trading agreement until perhaps November of 2020, that is clearly completely impossible. The problem then arises after that, and we are all guessing here, because one possibility might be that with his 80-seat majority, the Prime Minister simply turns around and says, well, I've done my best and I'm going to have to stay very closely aligned like the Norway model. That is a possibility. There is also the possibility that he crashes out with no deal, in which case I think many analysts think that that could only last a few weeks until the food supplies dried up and all of the other the problems arose. That's not a sustainable situation in the long term.
And thank you. And is there anything that can be done to, what can we do to help minimise these negative effects? Is there anything we can do as public health professionals?
Well, I think one of the things we can do is send out a very strong message to our colleagues from other European countries who are working among us in the United Kingdom to say that they are welcome. The Scottish First Minister has said this very clearly. Unfortunately, that hasn't been echoed in England. And but on our own individual level, we can keep an eye out for the increasing number of attacks that are on people who are now fearful of speaking in languages like Spanish or Polish in the street, and a number of documented cases have been attacked for doing so. So we should be very vigilant about the stigmatisation, the xenophobia, and the racism that is going to be occurring. I think we can seek to hold the government to account for its promises. We can ensure that demand that it does what it has said it is intending to do, although of course we know that many of those things are actually impossible, but we should do what we can there. We should document the effects, because of course we are the experts in doing health impact assessment, and we should certainly be doing that. And also I think we should be trying to maintain the links with the rest of Europe and the rest of the world, as we do in a time when it will be extremely challenging.
Thank you. And one of the things that the Faculty of Public Health, with our committee, with the British Medical Association, and indeed a number of other Royal Colleges, we've been very interested in, is there a possibility that we can link to you and your expertise to provide more evidence and information on future trade deals, because we hear a lot about future trade deals, but my understanding is we haven't actually got any in place yet. So is there something that we can do together to ensure that we've provided the information, the public health evidence, and really concentrate on those impacts?
We are looking very carefully at that. My colleague, Dr. May van Skulvik, who you will be talking to, has been looking in great detail at the proceedings of the select committees in Parliament on international trade, looking at the negotiating positions from the United States in particular. We already have a large body of work that has looked at this. We've previously published with colleagues at Bocconi University in Italy and the London School of Economics. We've published evaluations of NAFTA and the Canada-US Free Trade Agreement. We've looked at the KORUS, the Korean-US Agreement, and so on. So we have a body of work that seeks to understand the issues that arise compromise around trade agreements is particularly challenging at the minute because the World Trade Organization is going through difficulties of its own, and the appellate body is non-quorate, effectively not functioning at the minute. So there are going to be difficulties there, but May has really been looking in immense detail at this, and I think finding a lot of things that people had not realised that are going to be quite challenging. The difficulty we face is that the United Kingdom has not negotiated a trade deal on its own for 40 years. And it's not just being able to read the rule book, it's being able to understand the case law and to understand the meanings of words, which even as I have been learning in recent months, things that I thought were actually fairly straightforward and uncontroversial, like alignment of good manufacturing practice, actually have a lot of pitfalls hidden in there. And it's not clear that the United Kingdom will be able to identify what those are and to mitigate them.
Well, thank you, Martin, and thank you very much for joining us this afternoon. I do hope this will be one of a series of discussions we'll have on this very important topic as we go into a very interesting year. Thank you.
Thank you
very much.